Today is a very special day because we have Letty Perez here from Pivot Health Insurance with us to talk to us about Pivot Health Insurance short-term medical products. As you guys are all aware, Pivot Health is one of our top carriers here at AHCP, and we are very, very fortunate to have her here with us this morning to discuss the benefits and the features of this very valuable product. I would like to let everyone know that the chat window is open. Like I said earlier, if you guys can all change in your chat window where it says to, there's a drop down button there. If you can change it to everyone so that everyone can see your questions, I would greatly appreciate that. Feel free to go ahead and type in your chats at any time. However, this is a webinar that is being recorded. So it is very important that we make sure that Letty gets through her presentation. So we are going to be answering all questions at the end of this presentation. So I don't want anybody to feel jilted, but we will be looking at answering all questions at the end of the presentation. I want to thank everyone again this morning for joining us. And thank you, Letty, for being here with us as well.
Good morning, everyone, and thank you again, Lisa, for having me host today. I'm very excited, and AHCP is a very valuable partner to Pivot Health. My name is Letty Perez, and I am the broker account executive for AHCP. So I am your go-to person for anything related to Pivot Health. Just a little bit of background on myself. I have been in the industry for 22 years, specifically in the short-term individual market. And I have been with Pivot for 3.5 years. So I come with just a little bit of experience. And just in case you were wondering, I did start at the age of 12. So, yep, don't want to give away my age. So just want to share with you today the product portfolio that Pivot Health has to offer your clients. A little bit of background. So Pivot Health, just so that you're clear, is not an insurance company. We are actually a product development, marketing, and management company. We were founded in 2015. And in 2018, we were acquired by healthcare.com, which is a leading insure tech company that provides data-driven solutions using proprietary algorithms. They are a lead generating company. So you'll see that my email address has the healthcare.com domain. And healthcare.com does market Pivot Health as its proprietary products nowadays. But the important thing is I just wanted to make sure that you're clear so that when you're working with a client, you make it clear to them that they're not going to say they have Pivot Health Insurance, because we are not the carrier. We design the products, we bring them to market, and we actually have insurance companies that underwrite the plans for us. So just to give you a little bit of background, because when you do log into your Pivot portal, when you get contracted to sell Pivot Health, you are going to see various products in the portal that you can quote and enroll. Today, we are going to concentrate on our short-term medical plans, which of course is our niche product. And you'll see there's a lot of plan options and designs available. We do offer an indemnity plan. It is called our Anchor plan. And that's going to be under the fixed benefit tab on your quoting portal. We do offer a dental and vision product, and that's available as a check the box or as a standalone product. So I'll tell you a little bit about that one, because you are going to see that when you offer your short-term plans. And then we also offer a supplemental guaranteed issue plan that's also available as a standalone product, as well as a check the box when selling short-term medical plans. So I'm sure most of you are very familiar with the short-term products, but I want to share with you today what makes the Pivot Health short-term medical products unique. So as I mentioned, you're going to see we have a large array of plan options that are bound to fit your client's needs and budgets. We do offer extended durations. as far as 3 by 364-day coverage periods. When offering an extended duration, there's going to be no additional underwriting. So keep in mind that the Pivot Health short-term products are simplified underwriting. So your client is going to be determined eligible based on how they can answer the application questions. There's going to be no additional underwriting done after that to decide whether or not they would be eligible for coverage. There's no new pre-ex look back. There's no new waiting periods for the subsequent policies. Benefits, including the copays and the benefit maximums, start over. So when it comes to the benefit maximums on the Pivot plans, please take note that they are not a lifetime maximum. They are a coverage period maximum. So those maximum coverages restart with each new policy. And then, of course, the out-of-pocket maximums also start over. We have plans that utilize national networks, but we also, our special sauce is what we call it. We have no network restriction plans. So we call these open access. These plans offer the client freedom of choice so that they can go to any doctor or any facility. And we will use reference-based pricing to help reduce those out-of-pocket expenses to the clients while meeting deductibles and coinsurance. And I'll be going over that with you in just a little bit more detail. Again, simplified underwriting. So there's not going to be a tobacco use question on our application because we don't do rate ups. We accept type 2 non-insulin dependent diabetics. We also accept controlled hypertension. We don't require a social security number on the application. So for non-US citizen clients, they just have to have resided in the United States for either 4 months prior to the application or 12 months, depending on which plan you select. So just to give you a little bit of background on that, we currently moved our Epic plans, which are underwritten by North River, of that 4-month residency question. Currently, our companion life plans still require a 12-month look back for residency to be eligible for the coverage. But our companion life plans are going to be undergoing an enhancement here. We are expecting it to roll out within the next week or so. So eventually, all plans are only going to require a 4-month residency. And besides that, there's going to be some great enhancements to those plans, including more wellness and preventive that I'll be sharing with you. Some of the plan benefits included on the Pivot short-term plans are plans that offer doctor office visit copays for those sick visits. We have plans that are 100% coinsurance, which means that once they meet the plan deductible, their max out-of-pocket would have been satisfied. We have plans that include preventive benefits, RX benefits, and some that include a supplemental accident plan to cover the deductible. Point Health, we offer a patient advocacy service through Point Health, and this is for our open access plans. Since there is no network restrictions on those plans, they can go to any doctor or any facility. We highly recommend that you direct your clients to use that service that is included in their plan to help them navigate and find providers that'll fit the needs and their budget. And then they also offer bill negotiation for those bills that the client is responsible for. Pivot Health has designed products for certain niche markets, such as student athletes. So yes, we cover high school and college athletes on our short-term plans. We offer child-only policies as young as 6 months of age. And then the largest segment of members on our plans are that pre-Medicare market. So that's 60 to 64 and 11 months of age still remains the highest market that we cover. And all of our plans are including free and unlimited telemedicine, which includes dermatology. And we added that onto our plans since the pandemic. And all of our plans are covered by A-rated carriers. So both the Companion Life Insurance Company and North River Insurance Company are A-rated carriers, because keep in mind, Pivot Health is not an insurance company. So just to give you an idea, the short-term medical product portfolio we offer. Our core plans, which I am going to go into each of these plans in a little bit more detail. The core plans are what we call our light short-term plans, and that is because they do have some limitations on some of the benefits. The classic plans are the plans we originally rolled out with back in 2015. These are going to be all open access plans, no network restrictions whatsoever. And again, we're going to use the reference-based pricing, and those plans come with that Point Health advocacy service tied to them. Epic plans. The Epic plans are the only plans that we offer through North River Insurance Company. And these are the most recent plans that we rolled out with about probably close to 2 years ago now. And these plans are designed to include a lot of wellness and preventive benefits, which is not included currently in our classic plans. And then we have quantum plans. Quantum plans are a PPO plan that utilize a Cigna network. Very rich in benefits. I call the quantum our Cadillac of plans. So let's go over what I'm going to do is I'm going to highlight some of the benefits on the plan so that you have a better idea which plans you would probably want to offer based on your client's needs and situation. So the core plans are underwritten by Companion Life Insurance Company. As you see, you've got two plan options under the core category, the core 1000 and the core 2000, and that's their respective deductible on each plan. They have an 80/20 for co-insurance. The co-insurance max out of pocket is $1,000. So obviously that dollar amount does not include the deductible. You do have to add that on. The coverage period maximum on these plans is $750,000. And these plans do offer prescription coverage, either a discount or prescription coverage with copays. So with the core plans, these plans are a passive PPO plan. So what do I mean by that? As you see here, the clients do have access to the First Health Network, but they are not tied to that. So if they decide to go out of network, the benefits remain the same. Whereas with a true PPO plan, if they go out of network, they may either lose benefits or their benefits will reduce. So this is a passive PPO plan. These plans also offer those office visit copays I mentioned. So there's going to be 3 visits per insured per coverage period, and that's combined. So if they went to a primary doctor once and they went to an urgent care or a specialty doctor twice, they would have used up those 3 office visit copays for that coverage period. And that is per insured per coverage period. Now, keep in mind, these do not apply to wellness or preventive visits. Those are for sick visits only. When it comes to the hospitalization benefits, I want to make sure that everyone understands these are the only plans, only the core plans have these limitations on the hospitalization benefits. So the dollar amounts that you're seeing on the screen are the maximum dollar amounts that the plan will cover. So what do I mean by that? Inpatient services. If the client is confined to a hospital, the maximum that the plan will cover would be $1,000. Anything billed over that dollar amount is going to be considered not covered. So you want to make sure that the client understands, even though there is a low deductible and a low co-insurance max out of pocket, that there could be some additional out-of-pocket exposure if they have to use the hospitalization benefits. So the majority of the clients that we're seeing on these plans is going to be child or children-only policies, as well as that younger age band under the age of 30. The classic plans. So the classic plans is just the category for those plans that we rolled out with back in 2015. These are all underwritten by Companion Life Insurance Company. These plans are all open access plans, so there's going to be no mention of any network. These plans offer the client the freedom to go to any doctor or any facility. As you see here, these plans do offer the largest array of benefit options. So you are going to want to get a little bit familiar of which plans are going to offer which benefits so that you can kind of narrow down your plan options. But the system, the quoting portal, is very easy to use, and it will allow you to make the adjustments on the benefits based on what the client is looking for. So you have deductibles ranging from $1,000 up to $10,000 on these plans. You have some options when it comes to the co-insurance. And then please note that the co-insurance max out of pocket on these plans do not include the deductible. The co-insurance max out of pockets range from $3,000 up to $10,000. Today, if you went to quote one of these classic plans on the portal, the co-insurance out of pocket maximum is listed under the tab that shows max out of pocket. That is going to change with the new enhancements here shortly. So it will show the true max out of pocket amount. So for now, you would need to add the deductible to that co-insurance max out of pocket. You've got two plans that offer those doctor office visit copays, same as I described with the core plans, 3 visits per insured per coverage period. And if they are looking for those office visit copays, they would need to look at either a choice plan or a deluxe plan. When it comes to prescription coverage, the choice and economy plan are going to offer coverage with a discount only. The deluxe and the standard offer the RX benefits with copays. And then the maximum coverages on these plans range from $100,000 all the way up to $1 million. So, and again, that is a coverage period maximum. It is not a lifetime maximum. So if you do offer that extended duration and they have $1 million max coverage, when the first policy ends and the next one starts, everything resets, including that $1 million, regardless of how much of that they used in the prior policy. And don't forget to offer the clients and suggest to them that they use the patient advocacy service, Point Health, if they need assistance finding providers and facilities that'll work best with the plan. I want to go over the reference-based pricing for just a minute here, because myself being in the industry for as many years as I have been, reference-based pricing was new to me when I came to Pivot Health. So for a lot of you, it's a process of maybe educating or enlightening your clients, where most clients feel that a PPO plan is always the best way to go. They're going to get the best pricing. What they don't realize is that plans that utilize a PPO network, they are actually paying for that PPO access fee. That gets charged to us. We pass that down onto the client in their monthly premium. So with the open access plans, we are able to keep the premiums a lot more competitive. So what does reference-based pricing mean? Essentially, it means that Pivot Health pays covered claims based on Medicare allowable or usual and customary charges for that covered service. So for a physician, we're going to allow 125% of the Medicare allowable or usual and customary. And for a facility, we're going to allow 150%. So the client doesn't have to do anything. Don't let them get intimidated that they've got to do any calculations or do anything special. When they enroll in a Pivot short-term plan, they're going to get an ID card. The ID card is going to have on it the information for the provider to submit the claim. And they also have the benefit verification department number for the provider to verify the benefits before the service. Providers will submit the claim to our TPA, which is Insurance Benefit Administrators, and their the claims are going to be repriced according to those percentages of the Medicare allowable charges. Payment is made to the provider based on those discounts that we took. The member receives an EOB that'll show the discount amount and what their responsibility is, if any. And on average, we are seeing about a 69% savings to clients on these open access plans utilizing the reference-based pricing. So in most cases, a lot steeper of a discount than they would even see with a PPO plan. Balance bill protection. This is super important to share with your clients. This means that if the client should happen to receive a balance bill from that provider or the facility due to that discount that was taken, they can send that bill in to us. We will go back and renegotiate with the provider. And if we cannot come to an agreement with them, we pay that balance bill on behalf of the client. So they only pay what they owe. So that's super important to explain to them. Our EPIC plans. The EPIC plans, as I mentioned earlier, are the only plans we offer underwritten by North River Insurance Company. The EPIC plan comes in two plan designs. We have the EPIC PPO and the EPIC base plan. So the EPIC PPO plan is going to utilize a Cigna network. Make sure that you're clear. This is not insured by Cigna. It is a North River Insurance Company plan, but we have the contract to use the Cigna network for the EPIC PPO plan. You want to make sure that the client understands if they're enrolling in this plan, they want to try to utilize the network whenever possible, because a lot of their benefits will change or they will have no benefits if they go out of network. The EPIC base plan is an open access plan. So with the EPIC base, it's going to work just like I described with the classic plans. There's no network restriction, no affiliation to anything related to Cigna. It is an open access plan, and we will use reference-based pricing. So they have the freedom to go to any doctor or any facility. With the EPIC plans, I mentioned these plans include a lot more wellness and preventive than our traditional plans offer today. And I say today because, as I mentioned, the classic plans are going to be undergoing some enhancements that are going to include more wellness and preventive than they do today. So the EPIC plans offer a wellness visit benefit. So after 90 days of being on the plan, they will have access to one wellness or preventive visit, and that's per insured per coverage period. And also we have an option of adding on when you're selecting the EPIC plan. If you're in a state that has both EPIC PPO and EPIC base, you're always going to see each plan design listed twice. And the reason for that is one is going to include prescription coverage and one is not. Make sure you select the correct plan, because if you do select the plan that does not include the RX, we are unable to go back and add it on. You would have to cancel the plan and re-enroll. Another thing with the EPIC plans, these plans are 100% co-insurance plans, which means that once the client satisfies their deductible, that is going to satisfy their maximum out-of-pocket. Some additional coverage that's offered with the EPIC plans, there's a supplemental accident rider that can be selected when enrolling the client. There's either going to be a $5,000 or a $10,000 benefit they can choose from, and that is going to cover any expenses incurred by the insured if they are injured in a covered accident and require emergency medical treatment within 72 hours. So, and keep in mind, that's a rider that becomes attached to the plan. So once the short-term plan expires, so does that rider. It is not standalone. It becomes part of the plan. And again, make sure you check that box. If you do not select it at the time of enrollment, we will not be able to go back and add that rider on. So some additional things, I apologize, I have my slides were out of order. But definitely the Epic plans are up and coming with being some of the most popular plans we sell. The quantum plans, I mentioned that I call these our Cadillac of plans. The quantum plans are underwritten by Companion Life Insurance Company. And you're going to have two plan designs. These are a true PPO plan utilizing a Cigna network. So whether you select the PPO high deductible or the PPO copay plan, they are both going to be utilizing that Cigna network. There's no open access when it comes to quantum plans. The third column on this screen is showing you how the benefits would differ if they went out of network. So again, you want to make sure that they are aware that they should utilize that network whenever possible. The out-of-pocket maximum on the quantum plans is truly $10,000. It does include the deductible. And if they select a $10,000 deductible, then that would be considered 100% coinsurance plan. With the quantum PPO copay plan, the client will get those 3 office visit copays, just like as I described with the core and the classic plans that offers those office visit copays. Those are for sick visits, 3 per insured per coverage period combined. The quantum plans also offer 1 wellness or preventive visit per insured per coverage period, and that will cover up to $250 towards that visit. Also, if they select the PPO copay plan, they will automatically get prescription coverage with copays and no deductible to be met first. Some other benefits included on these plans: if they are traveling outside of the United States and they require emergency medical treatment, they would have benefits. It would be considered out of network, but they would have benefits if they required emergency treatment outside of the United States. Included in the quantum plan is a supplemental accident benefit that covers up to 100% of the plan deductible for expenses incurred due to a covered accident if the insured required medical attention within 72 hours. So as you see, the plan is very rich in benefits and they are all included. So there's not a check the box where you can add or remove those additional benefits. Just a quick overview of the Point Health advocacy services. So keep in mind, these are offered included at no additional charge to the client for the open access plans. So some of the services that Point Health can offer the client, they call in, they give them their pivot policy number. They can help them search for hospitals, prescription surgery centers, and medical facilities that would work best with their client for what they need. They can actually compare estimated costs of outpatient procedures they need to schedule. They can do the transfer of medical records as well. And they can contact and schedule appointments on behalf of the client. And then the bill negotiation services. So once they do have a bill that is their responsibility, if they need assistance, they can reach out to Point Health. They can either call into the customer care line, or there's also a mobile app that they can utilize. And on average, they've saved 44% for clients using the bill negotiation services. Just want to go over a little bit because of these 2 ancillary products, because you are going to see these pop up as a check the box, depending on what state you're offering the short-term medical plan. So the Brilliant Dental plan is insured by Renaissance Dental. It is a PPO plan. There are no waiting periods on the essential and maximum plans. There are 3 plan options to pick from. And the essential and maximum plans are progressive plans, so the benefits do increase from year 1 through year 3 and then stay level. Another important feature of our Brilliant Dental plans, there is no maximum age. So a client can keep these, or you can sell this to a client who's 65, 68, 70, they can keep this plan until they're 100 years old if they choose to, so long as they continue to pay their premium. Routine cleanings are paid at 100%. They get 3 cleanings on the essential and maximum plan per coverage period. And child ortho benefits are going to be included only on the maximum plan. So if you are including children on a plan with an adult, you would want to offer them that maximum plan. Now, keep in mind, if you're selling a child-only policy on a short term, or you're going directly to the standalone tab to sell a dental plan, if the applicant is under the age of 18, they will not have the option of selecting the plan. Children can be included with adults, but there is no child only for the dental plans. The value plan is the only plan that has a 6-month waiting period for the basic services, and there's 100% coverage for preventive and 80% on basic. The dental plans come with an optional vision coverage that is a check the box that you can add on, and that is through Vision Care. Keep in mind, there is no vision available without the dental. Our Latitude plan. So this, if you're going onto your portal and you're trying to sell it standalone, it's going to be under the supplemental tab. This is our only guaranteed issue plan. It is a bundled accident, critical illness, hospital indemnity, and accidental death and dismemberment plan. There are 2 plan types. It's going to be a $2,500 benefit on the select and a $5,000 on the preferred plan. The cash payment is made directly to the member. Keep in mind that this plan will not coordinate benefits with any other insurance. So it's going to pay the member regardless whether or not there was another insurance in force and paid those bills. And there's also some additional non-insurance benefits included through the association that the Latitude plan comes with. So now, for those of you who have not yet gotten into your Pivot portal, when you get contracted to sell Pivot, you will get a welcome email from our contracting department, and it'll have your user ID or your agent number in the letter. You're going to go to www.pivothealth.com. You're going to go to that login tab. You're going to scroll down and go to the 4 agents. Use your writing number as your user ID to get registered into your portal. System is super user-friendly, easy to navigate. And I'm just going to go over some of the highlights. And of course, I'm always available to assist if you have any type of problems or questions. So once you are registered and logged into your agent portal, on the left-hand side, you're going to see the helpful links. I call this our library. In here, you're going to find the brochures for all the different type of products, as well as marketing materials, state mandate guides, all type of information that you would need as an agent. In the middle of the page, you see book of business. So almost instantaneously, when you submit a policy for a client, you're going to see that policy in your book of business. You're able to open up and see their documents as well as their ID cards in PDF. And then, of course, you have the Get a Quote tab. And this is where you're going to get started with quoting and enrolling a client. So Get a Quote, as you see across the top, you're going to see the tabs for the products that are available as standalone. The example I'm going to run through, of course, is going to be through a short-term policy. So you're always going to start with the zip code. The zip code is going to allow the system to only display the products and the durations available to that client in that area. Where you see here, select your plan type, we have it selected on short-term insurance. If you clicked on the long-term insurance, that is going to take you to our fixed benefit plan. If you are doing a child-only policy, you want to make sure that you check that box. You're going to populate date of birth, gender, first name of the client. Where you see email address optional, I would highly recommend you leave that blank. that is not going to assist you with emailing the client a quote. I'm going to show you how you would do that. If you're covering children or a spouse, you want to make sure that you add that on. At this point, it is going to affect the premium. When it comes to the desired start date, the system is always going to default to tomorrow. So if we were live on the portal, it would be displaying September 16th, 2022. The little calendar on the right-hand side of that box is going to allow you to quote and enroll a client as far out as 60 days from today. Now, just take a note that the client will get charged, whether their effective date is tomorrow or 60 days out. They are going to be charged immediately for their first 30 days of coverage. Then going forward, their charge will happen on their effective date each month, unless they call in and request to change that. But that's once the policy's in force. So the initial draft is always going to happen immediately. When it comes to the durations, the system's always going to default to the longest duration available in that area. Now, you're not going to see on this page an extended duration option. If you are looking for a 3x364-day coverage, if it's available in that state, you would start out with the selection of the 364 days on this page. If you know that your client does not need the coverage for more than 180 days or 6 months, you want to make sure that you check the box here and change it. One, it's going to affect the premium. And two, it's also going to give them the option to prepay for that 6-month policy upfront, which will allow them to get about a 25% discount on their premium. Click on Find Plans. The top of the next page is going to display 3 recommended plans. You do not have to select one of these, as if we were on the portal, you would see below are the listing of all policies available for your client to select from. We do have a filtration system. You can click on Show Filters. It's going to open up and it's going to allow you to start making some choices here on whether it's a plan type or specific benefits that the client's looking for. As you select the filters, it is going to start eliminating any plans displayed below that do not fit that criteria. So if you want to view all the plans, leave the filters untouched, because you will have the opportunity to go within each plan name and make adjustments to the benefits based on what's available by product. You also have an option of selecting up to 3 plans to share with the client. You would click on the Add to Compare once you've made the changes to the benefits within each plan name. And it does allow you to collect up to 3 different plan options. Obviously, this has been selected already, so you see that they are populated at the bottom of the screen. And then you can click on the Compare Plans box. That's going to take you to the next page. Here you'll have the 3 plans laid out side by side. If you click on the Show Differences, that is going to highlight the plan differences. Obviously, there's more to this screen. There are additional benefits that are displayed. And then, most importantly, you can email this to the client if they wanted to review the plan designs and the plan options. You can click on Email this quote, and that will open up a box. In the box, that's where you would populate the client's full name and their email address. And it also allows you to put in a personalized note to the client. Now, our site currently does not store the quotes that you sent out, but since you are sending them a quote from your portal, you will get an email, a copy of what was sent to the client. And the links inside the email are static, so you can go in and review them as well. Now, if you wanted to just share one specific plan and enhance the coverage by adding on other features, you would go back to Quote Results, pick out one plan, and below it, it'll say enhance your coverage. Here, you're allowed to go ahead and add on the dental as well as the latitude plan. And then you can click the details and it takes you to the next page. On this page, I'm displaying an Epic base plan. I wanted you to see what it looks like, to see the supplemental accident rider that I explained. And this is only going to be on Epic plans, Epic base or Epic PPO, where you can add on that supplemental accident rider. So you can add that. You can also add on latitude and dental on this page as well. And then you can email this to the client. So now you've got the one specific plan with the enhancements that you've added on for them. And this is what the email will look like. When you hit that email, the quote, you're going to get that same box again where you put in their name, email address, and the personalized note. And again, you're going to get a copy of this email in your inbox. So they can go on their email. They can actually take a look at the quotes online. They can open up and view a brochure, or they can start the application. So you're asking what happens if they start the application and they don't call me to notify me that they enrolled. Because the quote came from your portal, you will always be the agent of record on it. So you will get an acknowledgement letter almost instantaneously when they submit the application. And then you'll also see it in your book of business. And they get a welcome email as well. So they start the application. As I mentioned, the eligibility questions, the underwriting on these plans are simplified. So they have to be able to answer no to all the application questions. This is just one of the questions, and as an example, these are going to be updated with the new enhancements. But couple of things, again, no rate up, so no tobacco use question. We do not have a height and weight, only a weight restriction. A female cannot be over 250 pounds. A male cannot be over 300 pounds. We also do not ask for the Social Security number. So again, it's only going to be whether or not they've resided in the United States. If it's an Epic plan today, it would be 4 months. If it's a companion life plan, it would be 12 months as of today, but that is going to change soon. Once they've answered no to all the questions, if they click yes on any question, it is going to stop them and let them know that they're not eligible for coverage. So once they've been able to answer no to all the application questions, they're going to complete their contact information. Email address is required, as this is all electronic. All their communication is going to be via email. And payment methods are going to be credit card or an ACH. We do not offer paper billing. If at this point of the application process, they need to change the number of days of coverage or the start or end date, they can click on that edit button, open up the calendar, make the changes, make sure that they click save to store that. Just wanted to show you what the prepay option would look like if you had selected 180 days at the onset of running the quote. It does offer them that 25% savings. And you're asking what happens if they sign up for the 6-month policy, prepay it, and then come month 4, they no longer need the coverage. We do prorate refunds for any unused premium, providing they have no outstanding claims on the policy. To complete the application, they have to sign off on all the disclosures. They do have a 10-day free look period, which will allow them to cancel for any reason and get a full refund, including their enrollment fee. Electronic signature. So if it's a click to check the box, that's it. If they want to complete the application on their own, you will need to send them the quote. There is no button on this page to just send them the signature portion. Just want to make sure I mention, we have a Ready, Set, Right bonus for those of you who have not started selling Pivot Health yet. We are going to pay you on your first 3 applications, and we do run quarterly bonuses. This is the Q3 bonus that will be ending on September 30th. But we will use those 3 first policies that we paid you on towards your 5 baseline to qualify for the quarter bonus. And don't worry, another bonus will be starting on October 1st, and we'll be sure to share that information with you. I'm going to leave up my contact information because I want to make sure that everyone can reach me if you have questions or you need assistance. And I'm going to turn it over to you, Lisa.
I want to thank everyone for joining us this morning. I especially would like to thank Letty for being here with us.